Hello my fellow college and esteemed audience, thank you for watching student project of small group discussion basics. My name is Putu Nadia Anandita Prasanti and my last 3-digit student number is 150. At this occasion, we would like to present our student project entitled Spondylosis, Spine Degenerative. But before we move on to the next slide, let me introduce our team. And for the first speaker, time is yours.
First of all, my name is Devalin Zara Ramadan with class number 016. I will tell you about this student project background. Spondylosis, commonly known as spine degeneration, encompasses a spectrum of degenerative change that affect the spine, often associated with aging, injury, or poor posture. Spondylosis is a multifaceted condition characterized by the gradual deterioration of the spine components, including the intervertebral disc, facet joint, and vertebral bodies. As the structure undergo degenerative change, various symptoms might arise, ranging from mild discomfort to debilitating pain and neurological deficit. By delving into the symptoms and mechanism of spine degeneration, we can deepen our understanding of this complex entity and strive towards more effective strategies for treatment and management.
So hello everyone, my name is Adelia Pramesti with my last 3-digit number 165, and here I'm gonna mention about the problem formulation, objectives, and benefits. So the first one is the problem formulation. What is the definition of spondylosis and its epidemiology? What are the etiologies and risk factors of spondylosis? What is the pathophysiology of spondylosis? What are the symptoms of spondylosis? How to diagnose spondylosis, and what are the differential diagnoses? How to evaluate spondylosis? What are the treatments and managements of spondylosis? So the next one is the objectives. First, to describe the definition of spondylosis and its epidemiology, to explain the etiologies and risk factors of spondylosis, to explain the pathophysiology of spondylosis, to describe the symptoms of spondylosis, to explain steps on diagnosing spondylosis and its differential diagnosis, to explain steps on evaluating spondylosis, and the last one, to explain the treatments and managements of spondylosis. So, what are the benefits? First, theoretical benefits. This paper can be used to increase knowledge about spondylosis, its definition, epidemiology, etiology, risk factor, pathophysiology, symptom, diagnosis, differential diagnosis, evaluation, treatment, and management. So the second one, practical benefits. For readers, practical benefits for readers are being a source of information and references regarding spondylosis, its definition, until the management. For writers, practical benefit for the writers is to increase the experience and knowledge of the writers in writing scientific works. The results of this work are expected to be a source of reference for the writing of other scientific papers. And for the academic institutions, practical benefit for academic institutions is it can be used as a reference for academic institutions to develop knowledge about spondylosis, from its definition until the management.
Let me introduce myself. My name is Amanta Petra Theobat with last 3 student numbers 108. So the definition of spondylosis is a degenerative disease of the spine in which the vertebrae have been damaged, whether in one side only or unilateral or both sides or bilateral of the pars interarticularis area. The pars interarticularis is the connection of the vertebrae superior and inferior articular surface. The disease is usually result by repeated injuries to immature growing of the skeletal and might come with a vertebral body slip. Spondylosis usually diagnosed at the age of 15, and there are some risk factors that increase the prevalence of spondylosis, such as concurrent pathologies, male sexuality, and adolescents with sports. Prevalence of the cervical spondylosis peaks at the age over 60, and while lumbar spondylosis peaks at over 40s.
Greetings, my name is Yensgal Linjet with last digit number 119, and here I'm going to explain about the etiology of spondylosis. So as a degenerative disease, spondylosis is recognized as osteoarthritis of the spine as it involves osteoarthritic changes shown on the screen, which primarily occur due to aging. So, the factors that predisposing to these changes can be accounted for anatomical features of the cervical spine, congenital canal stenosis, or biomechanics, which include improper posture, stress, sport, or occupations. However, it is evidently supported that the ambiguity on identifying the definite risk factors of spondylosis still persists, although it turned out some are not the possible determinants for increasing spondylosis risk. Age and gender are two definite factors. Additionally, variations in canal body ratio, canal diameter, vertebral body diameter, raise, weight, and height of the patients are not the risk factors of spondylosis. So ultimately, recognizing multiple risk factors will expedite the execution of appropriate prevention and management before further complications. Therefore, studies to a greater extent regarding risk factors of spondylosis are naturally very essential.
Hello, my name is Kada Bintang Arstia Putri with my last 3-digit of my student number is 056, and I'll explain about the pathophysiology of cervical spondylosis. The impairment of intervertebral discs, which become damaged, lose water content, and lose functions with ages, are the cause of cervical spondylosis. The loss of water, proteins, and mucopolysaccharides within the intervertebral disc make it shrinks and more fibrous because of its dryness and the lost elasticity of the nucleus pulposus. These conditions will form a disc herniations that disturb the annular fibers that induce the peeling of annular and surface fibers involved in reactive bone formations or osteophytes, which form along the ventral or dorsal margins of the cervical spine. The spinal canal and intervertebral foramina could be affected by those osteophytes, which will form the disturbance in the load balance and makes the uncovertebrals and facet joints become hypertrophy, and osteophytes formations will disturb neural foramen. The facet and uncovertebral joints can both compress the root, result in cervical spondylotic radiculopathy. That's all from me, and the next slide will be presented by my friend. Thank you.
Hello, my name is Putu Nadia Anandita Prasanti, and my last 3-digit student number is 150. Today, I would like to explain about the pathophysiology of lumbar spondylosis. The function of the spine relies on the coordination of spinal components such as intervertebral disc, vertebral bodies, facet joints, and capsules. These components undergo degenerative change with age, increasing the likelihood of intervertebral space narrowing or disc compression. The intervertebral disc, acting as a shock absorber, lose elasticity over time. Narrowing of the intervertebral disc or space can compress the nerve roots, potentially causing disability. According to the Willis and Bernard, there are 3 phases of degenerative development, such as phase 1 or dysfunction phase, phase 2 or instability phase, and phase 3 or stabilization phase. Phase 1 is characterized by early tears in the outer annulus lead to decreased height or disc, accompanied by increased innervation and pain signals. Phase 2, or instability phase, characterized by loss of mechanical integrity, internal disruption, and facet degeneration occur, potentially leading to instability and subluxation. And the last phase, or stabilization phase, is characterized by fibrosis, disc space constriction, osteophyte development, and transdiscal bridging. That's all from me. The next slide will be continued by my colleague. Thank you.
Hello everyone, my name is Nimadi Aprilia Risianti with 3 last digits of student number 229. Today I will explain about the symptom and also the diagnosis. Cervical spondylosis. Common symptoms include vertigo, nausea, vomiting, neck pain, and numbness in the area of the nerve root innervation. But in certain cases, this illness can also lead to high cervical spine abnormalities. Lumbar spondylosis. Common symptoms include lower extremities and buttocks pain. Patient can also feel weakness and difficulty of movement on the part of the injury. Okay, let's move to diagnosis. For diagnosis, we can take history taking, physical examination, and also neurological examinations and laboratory for the patient. That's all about this. Thank you.
Greetings, my name is Arianda Bella Maitri Anjasrini with the three last digit of student ID number 188. The differential diagnosis of spondylosis means separating it from other conditions that can cause similar symptoms and radiological findings. There is some differential diagnosis that we wrote in this paper. The first one is degenerative disc disease, which is the gradual breakdown of intervertebral disc. Meanwhile, spondylosis primarily affects the vertebral bodies and surroundings of tissue. The degenerative disc disease affects the discs themselves. The second is spinal stenosis, which is defined by a narrowing of the spinal canal, can cause similar pain and discomfort, particularly during physical activities. And the third one is disc herniation, which is characterized by the protrusions of disc material, which can compress spinal nerve and result in pain, tingling, or weakness in the extremities. Other less prevalent but significant differentials include inflammatory conditions such as rheumatoid arthritis and ankylosing spondylitis, which can cause spinal fusion, stiffness, and pain. Furthermore, malignancies such as tumor or metastasis of the spine may present with symptoms similar to spondylosis, necessitating a thorough examination including biopsy if required.
Okay, thank you for the time. My name is Sarah Putri Bungaran with 078 as well as 3 digits of my student number. And this time I'm going to explain about the evaluations of spondylosis. Actually, universal guidelines as protocols for the evaluation of spondylosis do not exist. But CT is considered to be the gold standard, although MRI should be used as the first line imaging modality in adolescents. However, if suspecting a patient with this disease, plain radiographs can be performed. Okay, so I'm going to explain the first one is plain radiograph. Typical of the plain radiographic image in spondylosis is the classic dog appearance where the pars interarticularis represent the dog's neck. This evaluation is not optimal at various levels for suspected spondylosis. In addition, the drawback of evaluation using plain radiography is its limited sensitivity compared to CT and SPECT. And the second one is computed tomography or CT. Hypodense cortical fracture at the pars is the appearance of spondylosis found on CT. However, CT is not all good when considering the prevalence of spondylosis in children. Unnecessary radiation from CT, where CT exposes the patient to ionizing radiation, is of particular concern in this young patient population. So, further imaging modalities such as MRI, bone scintigraphy, or SPECT are required. And the third one is single photon emission computed tomography or SPECT. The appearance that appears on this examination as a positive result is characteristic triangle-shaped area of increased cellular activity when viewed from the lateral angle. SPECT and bone scintigraphy have a very high radiation exposure and high rates of false positive and false negative as other etiologies of back pain. Thus, further evaluation using MRI or other modalities is necessary. And the fourth one is magnetic resonance imaging or MRI. The appearance that emerges on MRI is hypersensitivity in the pars interarticularis, which is a marker of osteoblastic activity and edema in early spondylosis. Fractures can also be seen on MRI with low intensity cortical bone defects. Other appearances include deviation of the spinous process and sclerosis of the contralateral pedicle. And maybe that's all from me for the next speakers. Time is yours.
Okay, let's talk about the management and treatment for spondylosis. So the severity of spondylosis determines the course of treatment for spondylosis. So non-surgical options vary from using NSAID, antidepressant drugs, epidural steroid injection or ESI, exercise therapy with NSAID, and transcutaneous electrical nerve stimulation or TENS. When these non-surgical interventions fail, that's when we have to consider giving surgical intervention. So surgical intervention varies based on the site of spondylosis. So it could be from cervical or lumbar spondylosis. We will further discuss them in our article.
I'm Angelica Farnaangawan with the last student digit number 092, and I will explain about the non-surgical treatment. Spondylosis can be managed through various treatment approaches, either non-operatively or operatively. For patients experiencing pain without neurological deficits, conservative measures such as analgesics and physical therapy are commonly recommended to alleviate the discomfort, enhance functionality, and prevent nerve damage. Non-operative treatments include pharmacotherapy, with NSAIDs being a preferred initial option due to their anti-inflammatory and analgesic properties. On the other hand, Opioids may be considered for insufficient pain control but are not recommended as first line or long term options due to their potential adverse effects. Antidepressants, muscle relaxants, and epidural steroid injections are also utilized to manage pain and improve function. Exercise therapy, focusing on strengthening and stretching muscles, delivered under supervision at regular intervals and with strict adherence, seem to be the most effective for treating chronic back pain. There's also TENS or transcutaneous electrical nerve stimulation, which can help reduce pain, but it's usually only for those who cannot do the exercise therapy.
We should start using surgical intervention when non-surgical measures have failed. The clinical condition and the pathological site determines the surgical strategy. An autograft, allograft, or artificial intervertebral disc is used in conjunction with a cervical discectomy or corpectomy as an example of an anterior approach to cervical spondylosis. When combined with bone grafts, anterior plates, metallic cages, and synthetic spacers, which has equal fusion rates, however, the long-term results remains uncertain. So an anterior approach is preferred method for treating patients with radicular discomfort caused by central or bilateral disc herniation, while a lateral disc lesion can be treated with either anterior or posterior approach. When cervical lordosis is lost or patients have myelopathy and pathological compressions up to 3 levels, anterior cervical discectomy and fusion or ACDF is employed as a treatment option. Laminotomy, foraminotomy, laminectomy, laminoplasty, and partial discectomy make up the posterior method for cervical spondylosis. In individuals with foraminal stenosis caused by lateral disc herniation and or bone spur development, foraminotomy alone is sufficient. Patients who require decompression at 4 or more levels or whose anterior column is already fused may benefit from laminectomy or laminoplasty. For a posterior approach, a preserved cervical lordosis is essential because it permits the spinal cord to move dorsally after decompression. In order to maximize the posterior shift of the spinal cord and aid restore normal lordosis, patients with flexible cervical kyphosis will need extra cervical posterior instrumentation. As for lumbar spondylosis, spinal fusion or decompression or both are the two main objectives of the surgery. And several surgical techniques have been created to accomplish these objectives. So, patients with excessive mobility or spinal malalignment, such as those with spondylosis, may be candidates for spinal fusion. So, there are several methods for surgical fusion, but they all include growing a bone graft in between the vertebral segments to reduce related mobility. So patients who exhibit unmistakable signs of neural impingement may consider decompression surgery as a means of addressing bone or disc incursion, such as that found in degenerative spondylosis, disc herniation, osteophytosis, or spinal or even foraminal stenosis.
Greetings, Doctor. My name is Gabriela from Burstafita with my last register number being 118, and today I'd like to conclude our student project. So, spondylosis or spine degeneration is a multifaceted condition characterized by the gradual deterioration of spine's components, including intervertebral disc, vertebral bodies, and also facet joints. It affects individuals across the lifespan and is often associated with age, injury, or poor posture. The pathophysiology of spondylosis involves a complex interplay of biomechanical changes leading to compression to the neural and vascular structures, resulting in symptoms ranging from mild discomfort to debilitating pain and also neurological deficits. Diagnostic tools such as plain radiographs, CT scans, SPECT scans, and MRI play crucial roles in evaluating spondylosis and determining appropriate treatment strategies, whether they need the non-surgical interventions or surgical interventions. A multidisciplinary approach that incorporates medical rehabilitative and surgical interventions is essential for effectively managing spondylosis and also improving patients' quality of life. That would be all from me. Thank you. And for the recommendation of this paper, understanding spondylosis is important for professionals, especially knowing about the signs, symptoms, pathophysiology, evaluation, treatment, and also management of the disease. Due to its main symptoms being neck pain and back pain, it is difficult to distinguish them from other spinal disorders whose symptoms are similar. So it is necessary to completely understand its clinical and radiological signs of spondylosis. Further research and advancement in treatment modalities are also needed to enhance understanding and management of this prevalent and impactful musculoskeletal condition. That would be all from me. Thank you.
That's all about our presentation. We would apologize if there's any mistake or inconvenience. Thank you for the attention.